Dr. SOWMYA Rao. She is an endocrinologist at Phage Mangalore Super Speciality Clinic. She will be sharing with us her insights on the topic youngster and hypertension. Before proceeding further, would you like to add something to it, doctor?
Hi, I'm Dr. Soumya from Mangalore Specialty Clinic. So, we are doing this program to create awareness because most of the youngsters think that they're perfectly healthy. They may not be having any health issues and they have a very careless or negligent attitude towards their health. So, through this, we would want to create some amount of awareness so that we have a better society tomorrow and a healthier society tomorrow.
Thank you for that wonderful introduction, doctor. So let's start with our conversation then. So my first question to you is hypertension a disease of elderly?
Well, hypertension per se is not restricted to elderly people like what most of the people think. In today's times, because of very unhealthy lifestyle and stress factors and multiple other reasons, it is prevalent among the younger generation as well. So the most common causes of hypertension in young could be genetic causes. It could be because, like I already said, a very unhealthy lifestyle. It could be also some hormonal imbalances like problems with the adrenal gland, with the thyroid gland. It could be diseases with the kidney, like decreased blood flow to the kidneys, like in renal artery stenosis. It could be because of chronic kidney disease. It could be because of polycystic kidney disease. It could be because of multiple heart issues. It could be because of certain habits in which is more prevalent in the younger generation, like drugs, smoking. So this question telling that it is restricted to the elderly is no. I mean, I do not go with it anymore. It is we are seeing more patients who are developing hypertension at a very young age, at even 20 years of age, also.
Thank you for enlightening the audience with the causes of hypertension. So, my next question to you is since we know that young adults are less likely to know or seek care for their high blood pressure levels, so what would be your advice to today's youth?
My advice to the today's youth would be see, first of all, start practicing to have a healthier lifestyle. We never know who could develop hypertension, not necessarily only, see, since we are talking about only hypertension today, but not necessarily it is only hypertension which we see in today's younger kids. It could also be diabetes, it could be also psychological issues with to high stress. Multiple other health issues also have started developing in younger generation. So I would suggest if you have a very strong family history, that is, if your parents or grandparents have uh, high uncontrolled sugars or high blood pressures or they have cardiac issues, kindly go for a normal routine health checkup or consult a doctor at least once in a year starting from the age of 20. If no other family history, still I would suggest all of you to start going for a regular health checkup every single year from the age of 20. Also, if you start developing symptoms like chronic headache, fatigue, then a blurring of vision, giddiness, or increased weight, tiredness, or breathing difficulties, when you're not able to walk a shorter distance, all these symptoms, if you start developing, or you have increased frequency of urination, you have increased hunger, you're losing weight, or you're gaining weight, any of these symptoms you start developing, and it is consistent for a period of time, then please do not ignore these symptoms. Consult your doctor and seek help. Not necessarily that you would have any issue, but at least you will be able to rule out any other chronic issues and prevent complications later on.
Young adults, please take the note of doctor's advice. So, my next and final question to you, doctor, is what are those must do's for the youngsters today to reduce their heart burden?
Okay. First of all, very important, a very healthy lifestyle. So, consume food which is very good in nutrition. That is a balanced meal which has 75% of the Your food plate should contain greens, vegetables, and proteins, and a very small portion, 25% of your plate should contain carbohydrates. You should also consume good amount of healthy fats. Maintain a healthy weight. So ideal BMI of 20 to 25 is an ideal BMI. So have a good weight. Be physically active. Go for a walk. Go for a jog. If possible, 20 minutes to 40 minutes of gym training, cycling, swimming, any form of physical activity. If you're not having enough time to hit the gym, at least practice some basic exercises, strength training, at least at home. You can spare 20 to 40 minutes in a day for exercises. Also, uh, eating a good balanced meal, being physically active is not sufficient. Also, you have to be mentally stable. So, decrease your stress levels, decrease your screen time. Also, get enough sleep. So today's generation people are so, I must say, they do not get enough sleep. They are stuck to their phones or I don't know, maybe the laptop, their work. Everything is demanding more from them. So still make at least 6 to 7 hours of sleep every day. Second of all, I would suggest all of you to quit smoking, limit the use of alcohol, don't get used to drugs and don't fall into the trap of drugs and other unhealthy habits. And the most important thing, if at all found to be diabetic or hypertension or any other chronic conditions, do not miss your doctor consultation, do not skip your medications, go for regular follow ups, and uh, keep your sugars, your blood pressure, and all your basic parameters under control. Along with this, practice yoga, practice meditation, and spend quality time with friends and family. Don't always be under work stress, or if you're studying only and stressed about studies, have some time for yourself, sleep well, and be happy. Like I always tell you have to be healthy to be happy. See, everybody's motto ultimately is to be happy. But if you're not healthy, you cannot be happy. Take care
So
of your
on
health.
this, yeah. So on this note, doctor, thank you so much. It was a very insightful session. I request all the viewers to follow BPIC page for more such insightful videos. Thank you so much, doctor, for letting us have you. Have a nice day.
Thank you, Rashi. Same to you. Have a nice day.